Your child has a high fever. They're coughing, and as you watch them, the lower part of their chest is violently pulling inward with every breath. According to the World Health Organization, you don't need a stethoscope to figure out if this is pneumonia. You can identify it right at home, purely by observing how your child breathes. Before you start, you need 3 things: a timer, a child who is resting quietly, and a clear view of their bare chest and stomach. You need this calm, controlled environment to get an accurate count of their breathing. That exact count is the critical first step in determining what care they need. If your child has both a cough and a fever, your immediate next step is to check their respiratory rate. To avoid miscounting, you need to know what to look for. 1 complete breath equals 1 full rise and 1 full fall of the chest. Do not estimate or multiply. You must count every single breath for a full, uninterrupted 60 seconds. Danger thresholds for fast breathing depend entirely on age. For an infant under 1 year old, the threshold is 50. Counting more than 50 breaths per minute indicates fast breathing. For a toddler between 1 and 5, the threshold drops to 40 breaths per minute. When a child crosses these specific numeric thresholds, they are exhibiting clear clinical evidence of a serious lung infection. The most severe physical sign you need to look for is chest indrawing. This happens when the area just below the child's lower ribs pulls violently inward right as they inhale. This pulling motion occurs because the lungs are heavily infected and physically stiff. The child's body is forced to use intense mechanical effort just to pull in enough oxygen. Do not confuse this with normal belly breathing. A healthy resting child will push their stomach out slightly when they breathe in, without that sharp inward collapse at the ribs. The next major danger sign is regarding their energy. Observe carefully if the child is entirely unable to drink milk or take in any food. If you see either chest indrawing or an inability to feed, the child's body is actively failing to secure the oxygen and energy it needs to survive. If you detect fast breathing based on your 1-minute count, but there are absolutely no severe danger signs present, schedule a standard doctor visit. For this standard pathway, a doctor will typically prescribe a course of oral antibiotics, like Amoxicillin, to clear the infection at home. However, if you observe chest indrawing or an inability to feed, stop observing at home immediately and rush the child to the nearest hospital. In these severe cases, the child requires immediate medical intervention, specifically supplemental oxygen and intravenous antibiotics. Classifying these visual symptoms accurately in your own home dictates exactly what happens next. It is the deciding factor between needing a routine prescription and securing life-saving emergency care. You now have the exact tools to assess your child. Remember the respiratory thresholds of 40 and 50 breaths per minute, and always watch the rib cage for chest indrawing. Pneumonia remains one of the largest single causes of childhood mortality worldwide. Taking these symptoms lightly carries incredible risk. Beyond monitoring for pathogens, clinical guidance suggests reducing environmental stress by protecting the child from extreme cold. Immunization is the most direct preventative measure available. Staying current with vaccinations significantly lowers the risk of the specific bacteria and viruses that lead to these infections. By understanding exactly how to measure and read a child's breathing, you are no longer a helpless bystander. You are the first and most critical line of defense in protecting your child's health.